I'm here with Dr. Jeff Sklar. He is my chiropractor, a chiropractor for the patients here at Cancer Treatment Centers of America. And I just wanted to talk about what chiropractic brings to a patient. I know what it does for me, and I just like Dr. Sklar to really talk about it and let us know, let you guys know what it does for the patients. So take it away.
Okay. Well, one of the reasons why Cancer Treatment Centers of America has chiropractic available at all its centers is because a lot of the patients that come here have pre-existing conditions and they have chiropractors at home. They want to continue their chiropractic care. However, a lot of chiropractors may be concerned if they don't have their most recent scans, x-rays, etc., and notes, that they don't want to put the patient in jeopardy. So I'm able to actually talk to the hometown chiropractors and let them know that it's okay to adjust in a certain area, or they may want to modify their technique or use a different type of technique in order to continue to treat the patient and alleviate them of whatever their chiropractic issues are without creating any further problems. Additionally, one of the things with chiropractic and cancer treatment is that there's a lot of side effects to radiation therapy, to chemotherapy, and with chiropractic we're able to address those issues in terms of neuropathy and reducing pain and those types of symptoms that can occur with the hands and the feet from the chemo. There's also different types of muscle fibrosis that can occur from radiation therapy. So we're able to address those issues as well. In addition, sometimes just people sitting for long periods of time getting their treatments or lying on radiation tables, that can create new pain as well. So my goal is not just to relieve pain and the symptoms, but also to be able to really create a sense of well-being and improve optimal health to the best of my ability as I work with the nutritionists, with the naturopaths, and certainly on the oncologists. So it's a team.
And that's what I find is so important, because everybody's on the same page and everybody's located under one roof, and they can go to each other's offices and talk about specific patients. I'm sure they've talked about me. No, I'm just kidding. In a good way, though.
Absolutely. Always in a good way with you, Don.
But I found that it worked for me. I don't have my band on right now, but with my lymphedema, I do some of the exercises, and with naturopathic, and nutrition, I do follow a regimen. And physical therapy has given me, and occupational therapy has given me different exercises to help facilitate flow with the lymph system. But when I first started here, we didn't have a chiropractor. And I was so extremely excited when they said he was coming, and now that he's here, and when I make my appointments, I always make sure I get chiropractic in there, as well as acupuncture, because I feel it's really important, and it does do such a good service to our bodies. How often should someone get chiropractic? Well, and it depends on what you're doing.
Sure. I mean, for patients at CTCA, it really does depend on what their symptoms are, what their treatment regimen is. So whether they're getting chemo or radiation, there's no real cookie cutter kind of recipe for it. So I pretty much base it on how quickly the patient responds, and if they're going home, say they're here for 4 weeks or 6 weeks of radiation, and then they're going home, we'll discuss, in terms of if they have a chiropractor at home, if they want to find somebody at home, and what I'll do is, if there's somebody in the area they want me to get in touch with, or they send a couple websites that I can review, and then we discuss it and kind of select, well, why don't we try this person out, and they can talk to me about your case. And so there's no real direct answer for you, but I always like an opportunity, anybody who's coming through for treatment, I always like an opportunity to explain to them, I can help you with the symptoms that you may experience. Hopefully, in some cases, some people do not have any of the symptoms, when they go through, and they're really fortunate. In most cases, we see some types, whether it's nausea, fatigue, muscle tightness, pain, tingling, burning.
what I've noticed is because when I have, because mine was my left breast, and this area where the edema is, it's so often tight and hard and everything, which is why I do the massage therapy. And I found I never would have connected doing chiropractic with it, seriously. But once I did, I said, oh, because I've gone to a chiropractor years ago. I said, oh, this is a great idea. You know, I'm feeling a little lower back situation going on. But it really has helped relieve and loosen, you know, the neck area. And usually after I finish my therapies, especially the massage therapy and then followed by chiropractic, I feel like the flow, I can get a little bit of relief with the flow.
Yeah.
It does help facilitate a flow. So I really like that.
One of the nice things about me having access to the scans too, and the way that I practice is a lot of people sometimes get concerned. Chiropractor? What if somebody has bone metastasis? And everything is, so as you've experienced, is really gentle and low force.
Yeah.
And certainly there are contraindications. Not every single person that comes is a candidate for care, and you know, or like I said, you know, sometimes I just need to modify the treatment to make sure that a patient is still going to be able to receive care, and yet they're only going to be able to benefit from it, and there will be no side effects. That's always the goal. So I hope you enjoyed it. I hope it was knowledgeable and helpful to you. And we will be signing off for now. And thank you so much. You know, I'm a hugger. I got to hug everybody. So thank you so much. And see you later.